Hi, my name is Tanya. I'm a nurse, and I work primarily in inpatient rehab. I'd like to thank you for attending this class today. This class will consist of some education about what strokes are and why they occur, as well as specific information regarding the emotional and behavioral changes that occur after stroke. Feel free to take notes throughout this presentation so that you can remember to ask your questions to your doctor, nurse, therapist, or case manager. First, I'll describe the origin and physiology of strokes. There are two types of strokes, ischemic and hemorrhagic. Ischemic strokes account for 87% of all strokes and result from an obstruction in a blood vessel, restricting oxygen transport within the brain. You can think of it as a clot type of stroke. Hemorrhagic strokes account for the remaining 13% of strokes and result from weakened blood vessels rupturing and allowing blood to flow into and compress surrounding brain tissue. You can think of it as a bleed type of stroke. There are two major subtypes of hemorrhagic strokes, including aneurysms and arteriovenous malformations, AVMs for short. Aneurysms are ballooning effects of weakened blood vessels. When they rupture in the brain, they become hemorrhagic strokes. AVMs are clusters of abnormally formed blood vessels that are at a higher risk for rupture. Symptoms of stroke can vary greatly based on the location of the stroke within the brain. Different areas of the brain are responsible for different functions or perceptions. Even the hemisphere of the brain greatly impacts the symptoms one might experience. Your right side of your brain generally controls the left side of your body and vice versa. There are certain defining roles that are unique to your left and right hemispheres as well, such as language, which is primarily controlled by the left side of your brain. Signs of a stroke can include sudden confusion, difficulty speaking or understanding speech, sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden difficulty with vision out of one or both eyes, sudden trouble walking, dizziness, balance, or coordination problems, sudden severe headache of unknown cause. One important acronym to remember is FAST, F-A-S-T. It stands for face, arm, speech, time. Face, facial weakness or drooping. Arm weakness or sensory changes, especially identified when one arm cannot maintain an outstretched position compared to the other. Speech, difficulty producing or understanding speech. And time is of the essence, and it's time to call 911. The time aspect of this acronym is really important because, especially in the case of an ischemic or clot type of stroke, there are medications and surgical procedures that can be done only within a short amount of time for those who qualify for these procedures. If you suspect that you or someone you know is having a stroke, you should get to the emergency room safely and quickly to rule it out. The prognosis and healing time vary greatly between all patients with stroke. Some factors for prognosis and healing time include the area of the brain affected, the type of stroke, the interventions used to treat the stroke, the time between onset of symptoms and treatment, and all of the risk factors we are about to discuss. The more risk factors you have, the more difficulty you may have recovering from a stroke, or the more likely you may be to have a single or additional stroke. Not everyone makes a full recovery from stroke. Not everyone has difficulty managing their symptoms after a stroke. Some people heal quickly, and some people take a long time to recover. Some of the most significant risk factors for having a stroke include high blood pressure, the most significant controllable risk factor, smoking. Nicotine and carbon monoxide from cigarettes damage blood vessels and create a higher likelihood for strokes to occur. Diabetes, which frequently accompanies high blood pressure and high cholesterol. And poor diet. Diets high in fats and cholesterol have a tendency to increase blood cholesterol levels. Diets high in sodium have a tendency to increase blood pressure. Now on to emotional changes after stroke. Following a stroke, you may experience many different and emotional behavioral changes. Emotional and behavioral changes. There are a variety of biological and psychological factors that can cause these changes, and it is important to acknowledge your feelings and emotions, to talk about them, and to realize that you are not alone. Some emotional changes can be due to brain injury or changes in the chemicals of the brain, while others are normal coping responses with the trauma of experiencing a stroke. Sometimes the part of your brain that processes information from the world around you can be damaged by a stroke, which may cause you to think and behave differently. Other effects of your stroke may also affect your emotions. For example, pain from your stroke may cause irritability. Feeling tired may interfere with your desire to socialize, and frustration due to needing help from others may cause you to feel anger and aggression. Some of the common emotional changes that may occur following a stroke include rapid mood changes or spontaneous crying or laughing that does not match a person's mood, lasts for an excessively long time, or that occurs at unusual times. Depression can cause a person to feel extreme sadness, helplessness, hopelessness, a lack of energy, enjoyment, or motivation, and it may affect eating, sleeping, and thinking habits. You may also experience feelings of lack of interest in life or caring what happens, known as apathy. Anger may cause you to lose your temper over things that did not used to make you angry, and it can sometimes lead to aggressive behavior, such as shouting, throwing things, and threatening people. This type of behavior puts yourself and others at risk, and it is important to get help so that you can learn how to manage it. Inappropriate behavior can sometimes occur after a stroke. This can include a loss in the ability to read and interpret social situations. For example, you may interrupt people when they're talking without realizing it. You may not fully think through decisions, or you may lose some of your inhibitions. This can cause you to say something before you think, or to act impulsively. It is likely that you will feel tired and a sense of fatigue after your stroke, as your body has to work harder to make up for a loss in normal function while your brain heals. A healthcare provider can rule out any additional medical conditions that could be having an effect on your energy levels and pinpoint the root cause. A lack of energy following a stroke can be caused by any number of factors, such as poor quality of sleep or nutrition. Lack of exercise, side effects of medications, coping with emotional changes, depression, or having to use more effort for everyday activities such as eating, dressing, and even concentrating. Several things you can do to increase your energy level include speaking to a healthcare professional to identify the cause of your fatigue, taking naps or rest breaks throughout the day, finding enjoyable activities that help you to relax and maintain a positive attitude, and staying involved with family, friends, and your community. Exercising or joining a health and wellness program after getting permission from your doctor, of course. There are things that you can do to help yourself cope with difficult emotions. If you're acting differently, your friends and family will likely be the first ones to notice. It is important to listen to them and any concerns they may mention to you. Remember that they are on your team and want to help you get better. Don't feel guilty about experiencing difficult emotions. And remember that there are reasons why you are feeling the way you do. A stroke can't change the person that you are. And if people say that it seems like you've become a different person, what they're really noticing are changes in your behavior, not the person you are. Look for support groups and stroke clubs to meet other people with similar experiences. Talking to a counselor or therapist about your feelings may be helpful for some people. Cognitive behavioral therapy, or CBT, is a type of talking therapy that focuses on how your thoughts and behaviors are connected Talking therapy allows you to discuss difficult feelings and think through your actions and the effects that they have on others. A therapist can also work with your family members. One stroke survivor said, "I wasn't able to cope with it all on my own. Talking to my doctor and getting some counseling was the best thing I ever did." Do activities that bring you joy. Exercise as you are able. Celebrate all the progress you make, even if it's small. Don't be too hard on yourself, and try to talk to yourself in positive ways. Speak to a healthcare provider about counseling, medication, or other options if necessary. Rest as often as you need to. If you are becoming aggressive, it is important to learn your triggers and talk with your family and friends about how to avoid these things. You can choose a word, phrase, or sign that your family and friends can use as a reminder for you when you need to calm down. You can also decide on a set amount of time that they can walk away and leave you alone for. These emotional and behavioral changes are likely to improve as you progress in your recovery and come to terms with your stroke. Give it time. Make a list of any questions that you may have to discuss with your healthcare providers. Here are some examples. What can my family do to help me when I'm emotional? Will these emotional changes improve over time? What can I do to decrease my tiredness? Could clinical depression be causing my tiredness? Are the medicines I take causing me to feel tired? As a family member or friend, having a loved one experience a stroke can be very traumatic and emotionally draining. Don't be afraid to ask for help in dealing with your situation. Therapy, counseling, or caregiver support groups may be helpful for some people. It is important to be patient and to remember that your friend or family member is still the same person, even if they're acting differently. Communicate with other members of your friend or family member's caregiving team to make sure that you are all on the same page. This will provide consistency in the ways that you all address your loved one's feelings and behavior. If your family or friends, if your family member or friend seems to show a lack of interest in things, developing structured routines and providing lots of encouragement can sometimes be helpful. Be sure to listen to your friend or family member and involve them in making decisions to provide him or her with a sense of control, which may be lacking in other areas. For instance, even if they can't make their own lunch, they may still want to choose what they eat. Conversely, you have a right to tell someone if they're behaving in a way that upsets you. However, it is important to be sensitive and keep the focus of the conversation on the person's behavior. Help your friend or family member to see why his or her behavior is not appropriate. Provide positive reinforcement when they do act in the right way. To a certain extent, you may need to attempt to adjust to the changes in your loved one's behavior. Compromise will be important. Finally, it is critical to take care of yourself. Look out for your own safety. And don't feel bad walking away when necessary. Be sure to get enough rest to maintain your own emotional well-being. Speak with your case manager, counselor, doctor, or therapist for local resources that can help you as a patient or as a family member or friend. In Santa Fe, please consider attending our monthly stroke support group that meets here in the hospital. Please ask for a flyer for the most up-to-date meeting dates, times, and locations. Thank you very much, and have a wonderful day.